Forget frequently asked questions.
Common sense, common knowledge, or Google.
How about advice from a real genius? 95% of people in any profession are good enough to be qualified and licensed. 5%
go above and beyond.
They become very good at what they do, but only
0.1%
are real geniuses. Richard Jacobs has made it his life's mission to find them for you. He hunts down and interviews geniuses in every field: sleep science, cancer, stem cells, ketogenic diets, and more. Here come the geniuses. This is the Finding Genius Podcast
with Richard Jacobs.
Hello, this is Richard Jacobs with the Finding Genius Podcast. I have James Shepard. He's an associate professor of internal medicine and infectious diseases at Yale. What's unique about him is he's done a lot of traveling. He's spoken to various governments such as, India, research programs, and Botswana, so he's got kind of a global perspective on infectious disease, which is very necessary. It's probably very different from someone sitting in a lab that, yes, they're studying pathogens, but literally traveling all over the world. So I think this will be a really good call, and I'm looking forward to speaking to him. So thanks for coming. How you doing?
I'm good. Thank you, Richard.
Yeah, so tell me, what have you been working on the past, 10, 20, 30 years? It sounds like it involves a lot of travel. So what's your work been about?
Well, I'm an infectious disease physician. I see patients now at Yale New Haven Hospital. But for the previous 15, 20 years, I have been a TB and HIV specialist working initially in Nigeria, rolling out HIV treatment programs for the US-funded President's Emergency Plan for AIDS Relief. And then I was running the CDC TB and HIV research program in Botswana in Southern Africa with one of the most severe HIV and TB co-epidemics in the world. And then I was seconded by the CDC to the World Health Organization in India, where I was advising the government of India on its national TB program. So I've been, as you mentioned, around the globe a little bit, primarily sub-Saharan Africa, but also a bit in India.
So what's it like being in one of these areas that's being affected versus just probably other people's perspective? They'll hear about it on the news maybe for a day, or again, if you work in the U.S. or, Europe, you'll maybe be studying samples, but you're not there with your hands in the guts of the situation. Like, what have you learned from?
Yeah, we work very much like we would in the U.S., but we have a lot more challenges. So when you do international work, particularly somewhere where the resources, the laboratory support, the human resources are much more limited in terms of numbers, you have to get creative. You have to be able to adapt, to change your plans, to work around issues, to focus on some of the most important problems, because you don't have the luxury of picking and choosing different things at different times. So you tend to focus and work very closely with the governments in the countries that you have been hosted to address priorities. And it's fun, and very capable organizations of people. There just isn't that many in the developing world. And so you don't have the luxury of having vast human resources at your disposal.
Do the governments that you work with, are they pretty responsible? Are they really concerned about their people? Or, is it a charade? What's the reality of it?
It depends. It depends on the country. It depends on the particular administration at that time. It's just like any government anywhere in the world. But the priorities can also be different when you're dealing with healthcare services and people's livelihoods. And the governments have very limited resources, so that the expenditure per capita is so much lower than it is on Europeans or North Americans, then certain priorities just fall by the wayside. And so if, for instance, you don't have the funds and the system to provide efficient treatment for a condition, then sometimes, the ministry might say, well, why should we have a diagnostic program if we can't help the people anyway? So you tend to come up against issues that you wouldn't normally deal with in richer countries.
Is there a lot of hope, or is there hopelessness, or, I know it depends, but in general, what's their perception of these governments?
I mean, there's a lot of pragmatism, the art of the possible. They are all very much limited, primarily by funds. So, the world is still a very unequal place in distribution of wealth. And so they have to make very hard choices for their people because they can't afford to support the same expansive services that, we as communities have become used to. You have to understand their motives and the delicate balance that they're trying to achieve with the resources at their disposal and the needs of their people, and not, mismatch those or make your priorities with such lack of perspective that it just doesn't fit properly into their pragmatic needs at that time.
How are the different diseases treated? If you have, let's say, malaria in a given country, and perhaps it's well understood on how to fight it in other countries, does that help, versus a disease maybe that there's no knowledge or very little knowledge on how to fight it? Any difference there?
Yeah, I mean, the global experience is very helpful. There is really not much that we haven't dealt with in some place at some time that can't be translated to a similar setting. And as I say that, I'm sure both you and I are thinking about the current situation with COVID and the coronavirus pandemic, which even now, even with this particular brand new disease that first hopped into a human in October or November last year, we have examples of experience and what to do and what not to do already in terms of the public health response to the pandemic. So, yeah, usually you can translate programs and ideas from one place to another.
What about tuberculosis versus HIV versus the other conditions? Are any of them, in your observation, far worse than others, or do they affect people in a different way that, I don't know, regardless of the response, do they affect the societies that they affect in a different way?
Well, it at the moment, I'm writing with a colleague and a kind of a summary, an opinion piece about some perspective on different communicable diseases globally and how COVID and the lockdown and social isolation, which Africa and India has also had to bring in, is seriously impacting the management of these other diseases. And you mentioned TB and HIV, and I could mention vaccination programs for measles or polio, malaria control, all of which are being severely impacted by the withdrawal, essentially, of healthcare workers from communities because of the fear of spreading coronavirus. And one of the things that we want to highlight in this piece is that we need to maintain some perspective, because coronavirus will, I believe, ultimately be a seasonal event that we will manage with probably a vaccine, whether it is a fully effective vaccine or not. But these other conditions, TB, HIV primarily, global pandemics that have been continuing for generations now. And the morbidity and mortality associated with them is likely to dwarf the disease caused by coronavirus. And so we mustn't lose perspective and focus on what really are the primary diseases globally. TB remains the world's biggest infectious disease killer. So it is number 5 in the global list of causes of death, behind things like cardiovascular disease and cancer. But it's the number 1 infectious disease killer and will remain so even after coronavirus has calmed down. So we need to keep our eye on the prize.
Well, if you're saying that these governments are pragmatic, I don't know. I mean, it doesn't seem pragmatic to lock down a whole society and then, tuberculosis and HIV and all that are unaddressed, and measles, and, consequently probably just as many or maybe 10 times as many people will die and be miserable. So that doesn't seem like a very pragmatic response at all. I mean, even in the U.S., they call everything elective surgery. So cancer patients can't get help, and it just seems non-pragmatic in the extreme. It seems all fear-based.
Well, it wasn't them that locked down the global economy and the global supply chains and logistics and movement of money. It was us. It was the rich northern countries, primarily from China through Northern Europe and the United States, that has essentially shut down the global economy and prevented normal business. And the poorer countries of the world, the sub-Saharan African countries, Asian countries, have followed suit, but really they had no choice, and they've not got a great deal to lose at this point because there was no ongoing activity or travel or business anyway. So, it would be a tricky conversation to point the finger one way or the other. But in terms of pragmatism, you're right. Our response has been more born of panic as a result of the spread of a new virus in front of our eyes, really, as we failed to implement the public health measures that would have been pragmatic and would have avoided some of the more severe aspects of social distancing that we've been pushed into.
Yeah, I didn't realize that. Well, I guess I should have. It's probably obvious, but a lot of these countries are dependent upon, first world medicines and interventions and vaccines and things like that. So that was cut off, is what you're saying. So they're doubly troubled.
Yes, I mean, their services too have to be safe. I mean, a measles vaccination program, for instance, they need PPE. And where do you think all the PPE's gone? There's none to be had in countries that can't elbow their way to the front of the line. The cold chain for movement of drugs and vaccines, the medicines themselves, most of which are made in China and India, are not moving. There's no supply chain currently, or at least a much diminished one. And they're entirely dependent upon importation for most of the raw materials for their programs. So you see that it's, they cannot operate independently from the richer nations that lock down.
Yeah, and I wonder if there would be a requirement. I'm not in any government, obviously, but I wonder if Western governments, for instance, or European ones said, hey, if you don't lock down and do this, that, the other, then, there's going to be no resumption of the supply chain either. And now, who knows how the, these things will be dictated and offered, and what will be required, in order for these other nations to accept what they're transferring to them.
Well, there are other examples of countries that delayed social distancing. The primary ones right now that you can see are Russia and Brazil, where the case count is exponential. It's one of the steepest epidemic curves of any for the coronavirus. And it's going to be a challenge to open up the global economy again, when there are such enormous reservoirs of active viral transmission going on.
Hey. What's your involvement then in coronavirus? Are you working with these these third world governments to help them in their response, or is your role the same but now complicated by the coronavirus? How has this changed for you over the past few months?
Yeah, a little bit of both. Honestly, the country I know the best is Botswana. and they have, I think, 30 cases of coronavirus confirmed. They locked down very strictly around the same time that South Africa locked down, which is their biggest neighbor and main trading partner. And so, to be quite honest, their problem with coronavirus is much less than New York City's problem, or New Haven, Connecticut, where, I still see patients and COVID patients in the hospital. So I don't know that we have a great deal to offer these countries. And from, what we've been talking about over the last few minutes, I think you get the impression that they have much more extensive, cost-effective public health systems than the United States has. And so they actually have the infrastructure to manage communicable diseases like COVID more effectively than we do.
Effectively how? Because they're able to say, stay inside or that's it? Or, how more effectively? What do you mean?
Well, they have systems that are more akin to the public health systems that Taiwan or Singapore or South Korea deployed to control the initial spread of coronavirus as it left China. Basic public health systems with efficient testing mechanisms, a certain centralized control and organization, and then a lot of community health workers that have become very popular for managing TB and HIV, because you don't need a PhD or an MD to make sure someone's taking their pills or following up their sick contacts. But you do need someone that's going to be responsible and report back. And they have many people that will do this, known as community health workers. So they began testing earlier than the United States did, because they used the WHO coronavirus test. And they had lots of people in the community to do case detection and follow-up of contacts. And at the moment, and it remains to be seen how this will continue, disease burden from COVID is much less than the U.S.
Oh, interesting. I wonder if you could say, in terms of reaction to, COVID-19, the U.S. is a third world response. Well, that it wouldn't even be accurate, but, not as good a response as some other countries. Interesting.
Yeah, I think that you would find most of my colleagues agreed that our response has been denial until the face of the problem became so steep that we had no option but to social distance. And the African countries have been much more proactive.
So how do you think that this is going to play out based on your experience with other diseases that are persistent, that are not going away? Nations have been handling them for decades, sometimes longer. What do you see the future of, COVID-19 being in terms of response of various governments, over the next 6 months versus, let's say, a few years from now?
Well, I think, let's say, over the next 18 months, I think COVID and the coronavirus will come back in a couple more waves, but steadily natural immunity will be building up in the communities. A vaccine may become available in the middle to late next year at the earliest, so it might be deployable for the fall season of 2021. And I think that the disease will moderate. So what we see for most new pathogens is that their tendency is to become less virulent as they spread in a new host. So I think the coronavirus will, although awful and has exacted a horrid toll on us this first round, will recede in its destructiveness, and we will be left with our old friends, HIV, which approximately 38 million people on the globe are infected with and will need lifelong treatment. TB, which as I mentioned, has been the number one infectious killer forever, and remains so, and continues to infect millions of people every year, new infections, and is becoming increasingly drug resistant and harder to treat. And we don't have a vaccine for either TB or HIV, and there isn't any prospect of one in the near future, that's for sure. And then if you think about, diseases that we stopped worrying about in North America, like measles and polio, measles particularly, which is much, much more infectious than coronavirus. It has an R number, a reproduction number of, say, about 15. So about 15 new cases arise from each case of measles. If the number of people who are vaccinated in a community starts to slip. And if you look at the news today, for instance, about 60% fewer kids in New York City have been vaccinated over the last 2 months compared with last year. So there's a cohort of children, and this is probably global because, as I mentioned, the supply chains are down and vaccine hasn't been shipped anywhere, and healthcare workers don't have PPE to administer it anyway. So there's probably a global cohort of children for the last 2 months or so who've not been immunized against possibly the most infectious disease that we deal with on a regular basis. And so I fear that we're going to see resurgence of global measles as a result of the COVID response. And it can be a deadly disease. Its highest burden of disease, its highest morbidity and mortality is in children, in contrast to coronavirus, which almost by far and away affects the elderly much more. And so the impact of measles is potentially just this year going to be almost as severe as COVID.
Oh, yeah, I didn't realize about this interplay and what's going to happen. Very interesting.
Yeah, it's what a sort of high sort of altitude global existence sort of gives you, as sort of an idea of how systems and diseases and the nuts and bolts of the global relationships can have a big effect on things. And polio, you may have been aware, was close to elimination as the second human infection to be wiped off the globe, the first being smallpox. And the global community, led by the WHO and the Gates Foundation and others, CDC, were on the final stretch to wipe out wild-type polio transmission from the last 3 countries on Earth that it still exists, those being Afghanistan, Pakistan, and Nigeria. But unfortunately, just as I mentioned with measles, those programs have been halted because of the challenges of doing them safely during the coronavirus pandemic, the lack of PPE, the lack of the cold chain for the measles vaccine, the polio vaccine, and the lockdown in Pakistan and Nigeria as a response to coronavirus. And so I think that we have taken a step backwards, and it will be years now before polio is eradicated.
Amazing. It's very good. What's the best way for people to get more of a, in addition to listening here, I mean, how can they get more of a global perspective? And do you think that, when they're in any given country, I would think that would help them, estimate the future, figure out maybe the future and what's going to happen. I would guess that you have, a pretty good sense of it. But what's the best way for people to learn more at this point, based on what you're looking at?
Well, there aren't really any great single sources. Obviously, the World Health Organization is the global meeting place for all health-minded people from all countries. But it is a highly bureaucratic organization, and it certainly doesn't deserve all the attacks that it's been under for its response to coronavirus. But I fear that the funding challenges that it's going to face as a result of the U.S. Withholding, it makes me wonder where one would really go and discuss and focus on global health priorities. There are two major philanthropic organizations that focus on global health priorities, the Gates Foundation and the Wellcome Foundation in the United Kingdom. And on their websites, you can see, all the current issues and focus and get a lot of information there. But sadly, our priorities are very much inward looking. And I fear that with the coronavirus and the impact that it's had, particularly on the United States, that has potentially the deepest pockets to help other countries with their own healthcare programs. Coronavirus will turn our gaze inward, and even more so, TB, HIV, polio, malaria, schistosomiasis, all of these programs will suffer as a result.
It's true. I spoke to some National Geographic explorers, and they thought that the same thing may happen with, the Earth itself and with environmental concerns. So, yeah, it's not good.
Yeah.
Well, James, very good. Thank you for your perspective. It's very useful instead of just a very narrow one. This broad one's excellent. So I appreciate you coming on the podcast.
Pleasure. Thank you, Richard.
You've been listening to the Finding Genius podcast with Richard Jacobs. If you like what you hear, be sure to review and subscribe to the Finding Genius podcast on iTunes or wherever you listen to podcasts. And want to be smarter than everybody else? Become a premium member at findinggeniuspodcast.com. This podcast is for information only. No advice of any kind is being given. Any action you take or don't take as a result of listening is your sole responsibility. Consult professionals when advice is needed.